Good afternoon. My name is Violet McLeod and I will be your moderator for today's press conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Premier, go ahead.
Thank you. Good afternoon, everyone. So we have 70 cases of COVID today, and the majority are still in HRM. The case numbers are down slightly, but we have to remember, as Dr. Strang told us, the numbers could fluctuate day to day, and that is due in part because of the increased testing that we are doing. Take Cape Breton, for example. There are 9 cases there today. That's still a higher number than usual, but we are testing more in CBRM, 4 times the usual rate. That said, I do like to see the downward trajectory in our overall numbers, and we have all of you to thank for that. You're coming out in record numbers across the province to get tested. We are doing 15,000 tests per day now, and we are expanding our asymptomatic testing to catch the virus even when people are not showing symptoms. Thank you. It is our best way to detect COVID. Catch it before it spreads. You're also following the protocols, including adhering to the gathering limits. I know it's hard, and we are doing our best to support you. I'm worried about our businesses, and I want you to know we are working on a package to support you during this difficult time. I can't imagine how hard it is to manage your business during the cycle of openings and closings, and I know you are frustrated. We had to shut down in order to keep everyone safe and slow the spread. Just know that I understand your livelihoods are at stake. These restrictions are difficult in the short term, but they will pay off in the long run. It is my hope that it will be a better summer if we can get our cases down and our vaccines up. We are in a race against the variants, and our immunization plan is gaining speed. We are now getting more shots in the arms of Nova Scotians at a faster rate than almost any other province in the country. I am so proud of this province and all of you, the frontline workers who are giving the doses, and the thousands of Nova Scotians who are coming out to get their shot. As long as we continue to get supply, we will have an opportunity for every Nova Scotian to get a shot by June. Dr. Strang, you and I will have more to say about that, right?
Absolutely. More to come tomorrow. So thank you, Premier, and good afternoon, everybody. 96, 75, 70. 2 days does not make a trend, but we are going in the right direction. I have faith that we can turn this situation around, but it will only happen if we all do what is needed. We've gone from low COVID activity to widespread activity in Halifax, and it happened quickly. And it could just as quickly spread to other areas of the province. So far, that is thankfully not the case. We are at a turning point. What happens next is going to go one of 2 ways, and our collective actions will decide that path. Either we get things under control now, and we can loosen restrictions as we head into the summer, or we don't. And these restrictions have to last a lot longer than 2 weeks. So my message today is just because you can does not mean you should. We need to closely follow the restrictions that are in place. It's critical. Lives, jobs, businesses, and our healthcare system are all at stake. We have been flooded with questions from people trying to get around the restrictions. People are also asking us to decide and tell them what they can and cannot do. We trust Nova Scotians to use their intelligence and common sense and decide what is best. And if you have to ask yourself if you can or you should, the answer is probably no. Don't do that or don't go there. Do not look for loopholes. We need to care for each other in our communities by living within or even going further than the restrictions. This is short-term pain for long-term gain. There is still some confusion about travel within Nova Scotia. If you need to travel out of your community for work or school, for a child custody arrangement or child care, for a medical appointment, or to get essential goods or services, all that is allowed. These restrictions are meant to limit non-essential travel. We also want to limit social interactions because we know that's how the virus spreads. Stay in your household group. Work from home if you can. Do essential shopping only, and please do not do it in a group. Pick one person from your household who is going to be out and about doing the shopping, if at all possible. And remember that outdoors is much safer than indoors when it comes to COVID. And we want people to be active and be outdoors for their mental and physical health. We're asking you to stay within your household outdoors as much as you can. And if you're outside with people who are not in your household, you must be at least 6 feet apart, and your group cannot be larger than 5 people. Before I close off, I want to give a shout out to public health, lab, and other staff who are helping with testing. They have been working around the clock over this last week to swab, test, and investigate, and to develop and implement new testing strategies. We've had to let some things go and focus on the most important tasks to make sure we can contain the spread of this virus. Understandably, things are taking a little longer than they did even a week ago. This is the highest level of activity we've seen since the pandemic started. So please, Nova Scotians, have patience. You will get your test result. You will get an appointment for a test. And please, if you know that you have been in close contact with someone who tested positive, do not wait for public health to call you. Start isolating right away. I know that most Nova Scotians are following the rules. You're all trying to understand what we're asking you to do. We have brought in 3 sets of ever-increasing restrictions in the last week, and it is a lot to keep straight. But if you're at all in doubt about what you should be doing, keep it simple. Socialize within your household only. Stay close to home, especially if you're sick. Do not travel outside your community unless you absolutely need to. Get tested and get your vaccine. Please make the right choices. Be safe and follow restrictions, and together we will get control over this virus once again.
We will now take one question and one follow-up from media in the amount of time we have for today. We'll begin with CBC Jean Laroche. Jean, go ahead.
Good afternoon. Dr. Strang, do we know how many people are currently isolating as a result of having tested positive or having been in close contact to someone who has?
I actually was able to look at that number today, and we have 4,909 individuals who have been identified as high-risk contacts and told to and are being followed up as 14-day household quarantine by public health. There's hundreds, or probably not thousands, more people who have lower risk exposures in the Halifax area and have been notified through a public notification process that they need to isolate. If they're lowest risk, they have to just get a test. If they're moderate risk, they have to isolate until they get their test results back. But so there's large numbers of people who are impacted by this and having even further restrictions on their lives because of known or possible exposures.
Jean, do you have a follow-up?
I do. Cases started to rise, Dr. Strang, in Nova Scotia around the 17th of the month. The province started imposing new restrictions, as you said. About a week after that, we now have 14 people in hospital, 4 of them in the intensive care unit. What does the modeling suggest the next week or 2 could look like when it comes to the strain on our hospital staff?
So I think I haven't seen precise modeling on this. What we do know is that the way we minimize the number of people requiring hospitalization is to control the spread, and that we expect that those numbers may increase to a small extent, but everything we're doing is meant to slow down the virus, decrease the number of people getting infected, and minimizing the number of people getting requiring hospitalization.
Next, we'll go to CTV's Natasha Pace. Natasha, go ahead.
Thank you. Premier, I understand you said that there are more supports coming for businesses. Will that be this week? Is there something else you can tell businesses who are struggling and say they need urgent help?
Yeah, I can fully understand the need to get supports quickly. I can just say that I'm in constant contact with our government officials, and I know I've received letters, and I can appreciate that. We're working really hard to find how we can get supports out as quickly as possible. We've engaged Dalhousie and the administration team that has already operated past programs. Unfortunately, I can't put a specific date on that. I'm pushing every single day to make sure that we get something in place soon.
Tasha, do you have a follow-up?
I do. Also for the Premier, last night Cassie Campbell-Pascal spoke out about the decision to cancel the Women's World Championship in Halifax. She suggested that was not consistent with the advice of Dr. Strang and had some criticism about the fact that you canceled instead of postponed the competition, and also that you compared it to the junior players. I'm wondering whether or not there's an apology that is being offered today. She suggested perhaps you could apologize to the players.
No, it's unfortunate that we're not able to have any activity, including hockey, in our province right now. We obviously, I feel for players that have worked their whole lives to get to the high level of skill to be able to perform in junior hockey. That's incredible. But at this time, it doesn't matter the level of hockey or any sport. We're asking for zero activity unless it's essential in this province. It was the right decision then. It was the right decision now.
Can I speak to that?
Sure, yeah, of course.
I haven't seen the exact quote, but this individual has no idea of the conversations that I had with the Premier. We're absolutely, the Premier and I were completely on the same page on this, so it's unfortunate she's making those speculative comments. Fully agreement with the Premier that in the state that we're in, even high-level hockey is a luxury that we have. Our priority is the safety and health of all Nova Scotians, and it would be inappropriate to have hosted a tournament, even at that level at this time.
Next, we have Canadian Press, Keith Doucette. Keith, please go ahead.
Good afternoon, Dr. Strang. I'm wondering about the tone in your voice today. You seem to maybe a tad bit exasperated. I'm just wondering. You said the most Nova Scotians, we're only 2 days into the lockdown, and you said most Nova Scotians are following the rules, but is it your sense at this point that perhaps not enough are? Am I wrong to say that? I'm just wondering about your feelings right now.
No, it's not. No, we're not getting it. The point of today is to make sure that if any Nova Scotians don't understand the severity of the situation, that we have put things in place, but now it's up to all Nova Scotians to do what they need to do, and every single person has to take it seriously. I can't say that strongly enough. If it's not exasperation, it's just making sure that everybody understands that we all have to be working together, and there's no room for one person to say, well, I can be relaxed. It's a collective effort, and we felt we needed to reinforce that message.
Keith, do you have a follow-up?
Yes, for the Premier. I know you met last night with your counterparts in Atlantic Canada. I'm just wondering, how did you come to that decision just to put it off indefinitely? Just give us an idea of your thought process there.
Well, I'm laser focused on public safety of Nova Scotians. That needs to be what I need to look at with the public health team, and we don't need to think about what's happening outside of our borders right now. I think the quicker to the point Dr. Strang raised, short-term pain is long-term gain. So we're hoping that this shutdown won't last too long, so that we can have a summer here. And if that means that we have better epidemiology at the time, then we can look at the discussion of a potential bubble. It's just not on the radar.
Next, we'll go to Global News. Alicia Drouse. Alicia, go ahead.
Thank you. Dr. Strang, I know that you've previously said that for privacy reasons you can't always necessarily give out the information of who's in hospital or even the ICU. That being said, we do know from earlier this week that at least one 20-year-old is in the ICU. And I'm just wondering, if we're seeing more young people hospitalized, and we do know that the variant is impacting younger people a little bit more, should we rethink our vaccine rollout to get the younger population vaccinated sooner? I know they're expected to start by the end of May, beginning of June, but I mean, if they're the ones being affected, should we not kind of be targeting that demographic right now?
So we're seeing certainly across the country, the variant is having more cases in younger people. Part of that is because we've got older age groups vaccinated. What we need to do is focus on getting everybody immunized as quickly as possible. And we'll be talking more about this tomorrow, but we're being very successful with our age-based focus, moving very quickly down through 5-year age cohorts. We're now down to 55 to 59-year-olds. Soon we'll be in the 50-year-olds, within a week or two, 40-year-olds. By once we get into June, we're into 20-year-olds. If we start to change our program now, then we have to readjust and we slow everything down. That would be the wrong thing to do. We have a good program. We'll get everybody vaccinated within the next 4 to 6 weeks. We need to stay focused on that, and anything that distracts us will actually put all Nova Scotians at risk.
I just want to add to that. I fully support this direction in the way that we've handled this so far. You're seeing the ramp up now. We're getting more shots in arms now than other provinces per capita day by day. And people can just minimize their own risk by staying home and sticking to their family bubble. We'll get through this, and we'll have more to say tomorrow on how we see this rolling out over the next 6 to 8 weeks.
Alicia, go ahead with your follow-up.
All right, this one's for the Premier. You mentioned that you are working on some supports for businesses and that you're, working with your provincial counterparts. And I'm just wondering, are you working at all directly, though, with small businesses who are actually impacted and finding out what exactly it is that they need?
So we've had experience with previous waves, and there's a cash flow shortage, obviously, and we're going to try to look at how we fill the gaps the federal government has. The labor supplements in place. We're going to need to ensure that we're giving grant money through the Small Business Impact Grant is a program that worked through Dalhousie. I've spoke to the Minister of Inclusive Economic Growth today to say that we need to make sure that we're getting this out as quickly as possible. And he's working with his department, who's engaged with our stakeholders in the business community.
Next, we go to All Nova Scotia, Kathleen Jones. Kathleen, go ahead.
Thank you. Premier, we are talking to businesses right now who are still waiting for the property tax rebate that the government announced about 2 months ago. I'm wondering when that's going to open, and what are you saying to those businesses who say that they're struggling every day, still be in operation, and that they don't feel a sense of urgency from the government?
Well, that's why I referenced it in my remarks. I feel their pain. I was in business before government, and I can understand the need to have cash flow coming in. You have fixed costs, your rent, your utilities, those costs don't go away. All I can say is we're working really hard to get something out. We will be there to support you, and I really appreciate the patience.
Kathleen, go ahead with your follow-up.
Thank you, Premier. I'm just wondering if you could specifically address the status of the property rebate program that was announced a couple months ago. And yeah, that's my question.
Yeah, I don't have the status with me. That should be rolled out in the near future. I'll have to get back to you on that one.
Next, we go to the Chronicle Herald, Nabal San. Nabal, go ahead.
Good afternoon. Dr. Strang, under the new restrictions, people can walk into NSLC, and it remains open for in-person service at 25% capacity. But private wine and specialty stores are only open for pickup and delivery. Can you please explain the rationale behind considering these private stores to be non-essential?
Yeah, we've looked at that and we've clarified today, and the communication is going out to that sector that private stores will have the same ability as NSLC. People can come in 25% of their maximum capacity for in-store sales.
Nabal, go ahead with your follow-up.
Thank you for that. Dr. Strang, you talked earlier about that we have close to 5,000 cases that have been at high risk or have been told that they're high-risk contacts. I was wondering if you can provide more information on the cases that we're seeing today. Are most of our new cases close contacts of existing cases, or did they get the virus from being at exposure sites?
So we don't know. I don't have that information from local public health. We're following up so many cases that in the Halifax area, we don't get that breakdown to be able to provide it at the briefings. We do know, however, that outside of HRM, it's good news. Where the cases we are seeing are some of them are returning travelers. We have a couple of rotational workers, some foreign students, all of whom are quarantining as they're supposed to, so there's no risk of transmitting further. And all the other cases, there's one in northern zone and 5 in eastern zone, which are close contacts of known cases. So we are not seeing signs of a community spread outside of the Halifax area. And every day we keep it that way, and the restrictions start to have their effect, is a day forward, and is good news.
Next we go to Radio Canada, Adrienne Blanc. Adrienne, go ahead.
Good afternoon. My first question is to know how many essential workers don't have access to daycare right now, and I'm referring to yesterday's statement by Premier Rankin saying that some of them needed daycare urgently. Thank you.
I don't have that number. Yesterday was about a general statement to Nova Scotians that are working from home, that if they could choose to have their kids at home, if that works for them, that might alleviate space and capacity, and that wouldn't impact their space, that their space would be held. What it also allows us to do is allow children that are over the age of 4 that are generally in child care centers to be able to have a space if they're essential service worker, if their parents are working, that the kids 5 to 12 years old, I think the cap is 12 years old, might be able to be looked after in one of those centers. So it was a general statement to be prepared should we have that challenge to face.
Adrienne, please go ahead with your follow-up.
And Dr. Strang, could you give us an update on the vaccine supply, and are you still committed to making sure that every Nova Scotian have their first shot before the end of June?
We'll have an update on that with much more detail tomorrow, but yes, we're on track, and certainly by once we get into June, every Nova Scotian who's eligible, including if we have to add on the 12 to 15-year-olds, we're quite well might be in that space by June. We'll be able to even include them and everybody getting a vaccination in June.
Next, we have the Halifax Examiner, Tim Bousquet. Tim, go ahead.
Hi, sorry, I had to unmute there. Dr. Strang, I just want to follow up on a question I had yesterday, because a couple of healthcare professionals have told me they think you may have misspoke or misunderstood my question. And that was specifically related to people who have tested positive for COVID. Can they go outdoors?
So that if I made it was confusing, I apologize for that. So let me walk through it. People who are quarantining because of travel, or even if they've even identified as a contact of a case, they are allowed to go outdoors with careful protocols, especially if they're in a multi-unit dwelling. They have to stay distanced, masked, hand washing before they go out. People are allowed to go out for up to an hour a day, once a day for up to an hour, staying within their local community to get doing it by themselves to get for their mental and physical health, to walk, run, etc. If people are isolated because they are a case, they cannot go outside.
Tim, do you have a follow-up?
I do. Very good. That's the clarification we were looking for. Thank you. I have a reader asked me a specific question about daycares, and that was that she sends her child to an unlicensed daycare, and they've had to close by the health order. She felt that there was quite a large population of people in her circumstance. Her spouse is an essential worker, and for whatever reason, she can't care for the child at home. So it's a problem for her. And I'm wondering if you can just comment on the situation with small unlicensed daycares.
Not closed unlicensed daycares like in wave one. We understand the need for childcare and unlicensed daycares, which still have rules around the number of kids they can have, etc. They are allowed to remain open. We did not close them.
Next we go to Saltwire, Chelsea Gould. Chelsea, go ahead.
Hello, Dr. Strang. Yesterday you said most MFRs got a first dose, but some fire brigades I talked to in Colchester County have not been contacted at all about getting vaccinated, and most returned to responding to medical calls about a month ago. Could you please clarify where things are at vaccinating MFRs?
So my understanding is there was a program to that all the MFRs, and just for people listening, it's not all volunteer firefighters. There's certain firefighters, usually in the volunteer departments, who have advanced training and they're medical first responders. And we've had a program to get them all immunized. So we'll have to follow up on that specific department.
Chelsea, do you have a follow-up?
Thank you. This is a question for the Premier. Given that travel within this province is limited and only for essential reasons, would you consider closing the borders to non-essential travel from PEI, Newfoundland, and Labrador?
Well, effectively, on a practical level, if those people were traveling in from PEI and Newfoundland, they wouldn't be able to move beyond the first county they were able to get to and stay in a hotel. So they would follow the rules that everybody else in Nova Scotia would. Currently sticking to the immediate family, and so right now we do have a closed border except for those two provinces that are very significantly less cases than we have here, and PEI's borders are shut down. So on a practical level, nobody's coming in from those provinces to Nova Scotia.
Next we go to the coast, Victoria Walton. Victoria, go ahead.
Thanks. Dr. Strang, I'm wondering about the capacity of the website for when it opens to 40 to 50-year-olds to book their AstraZeneca vaccines, if that's still happening. I guess tonight at midnight, I know a lot of people are planning to stay up, to wait for it to open, to book their appointment. And is there concern that the site is going to go down again like it did the very first time it opened? What's kind of the capacity? How many people can access it?
So it's certainly, first of all, it's not opening just at the stroke of midnight. So we'll have more to say on this tomorrow about when we give a vaccine update. But we will be making opening up to people of AstraZeneca vaccine for people 40 to 54 starting tomorrow. But we'll be able to say more at tomorrow's update around the specific timing of that.
Victoria, please go ahead with your follow-up.
Thanks. And I'm wondering about the AstraZeneca vaccine, the ones that we currently have in the province. How many approximately doses are still available for that upcoming age group? And have you said what the expiry date is on those doses when we need to get them all in arms by?
So there's my understanding is about 10,000 doses. It varies a little bit because people are booking and then shifting, but it was around 10,000 doses. That vaccine doesn't expire till the end of June.
And that is all the time we have for questions today. Go ahead, Premier.
Thank you. We're getting close to facing our first weekend in this latest shutdown. And while I have faith in all of you to follow the public health protocols, I am worried. It's so hard to stay in your house on a sunny day. It's hard not to see your friends and hang out. It's just all hard. This week is Holy Week for the Christian Orthodox community, and will be the second year in a row that they're not going to be able to gather for Mass because of COVID. But there are better days ahead. I'm sorry, but as you heard from Dr. Strang, this is necessary if we're going to slow the spread of COVID-19. We have shown that we can be the envy of the rest of the country. Yes, our cases are up, but together we are managing that. You are coming out in record numbers to get tested. Those eligible are getting their vaccines. But this weekend coming, the most important thing you can do is stay close to home. If you want to hike, do it in your own community. Go for a walk, but in your neighborhood. If you want to have a barbecue, stay in your own backyard. We are at such a crucial point in this fight against COVID. We are close to getting every Nova Scotian who wants one a vaccine by mid to end of June. Let's not veer off that path. Please follow the protocols and the rules around the shutdown. We need you to follow the rules. Together, Nova Scotia is stronger. Together, Nova Scotia, we can beat this.